Have you ever wondered if certain sudden changes in behavior or consciousness could signal something serious happening in the brain? Recognizing the subtle and not so subtle cues our bodies give us can be incredibly important. Urgent seizure warning signs are sudden, unexpected changes in brain activity that manifest as alterations in consciousness, behavior, sensation, or movement, requiring immediate medical evaluation. These are not always the dramatic full-body convulsions often depicted, but can be more subtle, indicating a critical need for prompt attention to prevent further complications or identify an underlying cause. At its core, a seizure occurs when there is an abnormal, uncontrolled electrical disturbance in the brain. Think of your brain as a highly organized city with electrical signals constantly flowing. When a seizure happens, it is like a sudden, chaotic electrical storm disrupting normal communication pathways. Urgent signs typically point to a new onset seizure, a cluster of seizures, a prolonged seizure, or a seizure occurring with other severe symptoms, all of which suggest the brain is under significant distress. Recognizing these urgent signs means observing changes that are out of character for an individual. These might include a sudden, unprovoked loss of consciousness followed by confusion, repetitive involuntary movements like jerking arms or legs, or staring blankly into space unresponsive to external stimuli. Other signs to watch for are difficulty breathing, bluish lips, or a seizure lasting longer than 5 minutes, which is a medical emergency known as status epilepticus. Observing if someone has a seizure and does not return to their normal state of awareness or has another seizure shortly after the first also indicates an urgent situation. It is also vital to note that some people experience an aura before a seizure, which is a specific feeling or sensation that acts as a warning. While an aura itself is not an urgent sign, the seizure that follows may present urgent characteristics. Auras can include unusual smells, tastes, visual disturbances, or a sudden feeling of fear or déjà vu. Understanding these individual patterns, combined with the more overt urgent signs, can provide a more complete picture for medical professionals. The immediate post-seizure period, known as the post-ictal phase, can also offer clues, especially if recovery is unusually slow or marked by profound weakness or confusion. Understanding these urgent indicators empowers you to act swiftly, ensuring that anyone experiencing these events receives timely medical care. Prompt evaluation can lead to accurate diagnosis, appropriate treatment, and potentially prevent more serious neurological consequences, ultimately safeguarding brain health and improving overall quality of life for the individual.